Real Country 1430 AM and 1073 FM WRDN. I'm Brian Winnekins. Joining us this morning, or today rather, is Health Officer Heidi Stewart with the Pepin County Health Department as we get a little bit of an update on COVID-19 and also the flu and some other stuff going on with the health department. Heidi, thanks for joining us. Well, health department's still in the crisis of care mode. Tell us about that.
Yeah, so crisis standards of care. We went into crisis standards of care when we got to the point where we couldn't keep up with cases. We couldn't keep up with contacting all of our close contacts. And what that basically means is that we ask others to do the contact tracing for us. So I'm going to go ahead and share screen, and it'll give you, are you seeing the screen that says case activity right now?
Yep, we're seeing it.
Yep. Okay. So you can see that, as this wave, which we're really in a second wave of this pandemic, the first one was during 2020 and into 2021, there was a definite stop or end of the first wave, which for Pepin County, that was around June. And then in July, we started seeing cases again towards the end of July. And if you have the online presentation access, you can see that those cases kind of stayed between really some days 0 cases a day to 5. Occasionally we had some spikes above that. Definitely. In the middle of September, we saw increases where we had over 10 cases a day, and then it went down, and it just really was inconsistent through the rest of September and October. And then our total cases, active cases per day, dropped down close to 20 again at the end of October, but then November came around, and we're at the highest peak right now that we've been for active cases per day since this second wave, which started in July. Over the weekend, we went above 20, we went above 60 active cases in Pepin County. And today we've had a little bit slower of a day, but the only reason today it's been slower is because the Wisconsin Electronic Disease Surveillance System is down and they're not sending us cases. So if you've tested positive today, we're not ignoring you. We just are not getting those reports from DHS right now. So we're relying on the hospitals to send us a fax, kind of the old fashioned way. So we have got some from Advent Health, but we're not getting any reports from external partners outside of our county right now, Brian.
When you've talked with Advent Health and Duran, do they still are they overloaded, or are they still doing okay with that? They're just sending you reports of active cases, but they don't have a lot of folks actually in the hospital.
We had 3 cases reported to us from Advent Health today, and one of them was hospitalized. I did look at some of the data from the first wave to the second wave. So the first wave, there was 864 cases. This wave, there's been 436 cases, but of course, a much, much smaller time frame, because we're talking July till now, right? Where we were talking a year and a half with the last one. The total hospitalizations with the first wave was 37. The hospitalizations with this wave is 28. So if you look at the time frame and the number of cases, the hospitalization rate is higher for this wave, whether that be the Delta variant or some other variant. Deaths with the first wave, we saw 7, and with this wave, we've seen 3, and we have not had one for quite a while, which of course is good.
Talking with Pepin County Health Officer Heidi Stewart today, getting an update on the COVID situation and also the flu. Meanwhile, Heidi, with the boosters and all of that, what have you been seeing with that? Has that been kind of progressing along, that people are getting those?
Yeah, so it is probably a good thing that the CDC and DHS designated, much like they did when vaccines became available early on. They designated specific groups that were eligible for the boosters right away. And now they've opened it up and are actually encouraging everybody that's 18 years of age or older to get that booster. And there's a few different reasons for that. So with that recommendation that came recently, we are booking up very, very quickly. We are down to myself and one other nurse at the health department right now. So scheduling those and maintaining some of the other programming is a little bit tricky, but we do have that scheduling link online. I think we're offering Pfizer this Wednesday, Moderna on Thursday, Pfizer and Moderna in Pepin on Friday, along with the pediatric, the 5 to 11-year-old Pfizer in Pepin and in Durand here at the health department on Friday. So we continue to be busy with vaccinations. Visit that site frequently if you're not finding something that works for you. And then also know that vaccines are available at local pharmacies, local physicians. They're available everywhere. There really should not be a reason for you not to have access to that vaccine if you want it.
Talking with Pepin County Health Officer Heidi Stewart today. Heidi, meanwhile, it's flu season. Have we had any reports of the flu here in Pepin County yet?
So reporting for flu is a little bit different than, let's say, reporting for COVID. We are notified of every positive COVID case, right? We're notified of every positive pertussis case, every positive chlamydia case. For influenza reporting, we are only notified at the health department if it's a hospitalization, a pediatric hospitalization, or a death related to influenza. So we don't get a report on every single positive influenza, but the state does do case surveillance, and I can share a screen that I will be showing at the Board of Health meeting. We are there. I'll wait to make sure. I don't think you're seeing the right thing. You're seeing the old COVID one. So let me try that again. Sorry about that, everyone. There we go. Are you seeing the respiratory surveillance?
Yep, we're seeing it.
Okay. You're still seeing it?
Yep, we're seeing it.
Good. So the Wisconsin State Summary, you can see here the light blue line for 2021 is really, really low for influenza-like activity trends throughout Wisconsin. And we knew that, right? We knew there wasn't much. We weren't too concerned about it. The small red line you'll see here is the beginning of the 2021 influenza season, and this is already at levels higher than most of last year. So they are anticipating, or at least we're being told, they are anticipating an influenza season this winter and spring. There's already been some outbreaks, specifically college campuses, where they're seeing influenza A, the H3 strain, and it seems to be spreading quite quickly throughout congregate setting groups. If you recall, the H3 strain, the H3 strain tends to cause a little bit more illness, and it can cause some more hospitalizations than some of the other strains. So it'll be interesting to see some of those mitigation factors that we're doing for COVID. It's important that we use those right now because they also protect us from influenza. So staying home when you're sick, staying home when you're sick. I know that people are excited about getting out and about, but it's just really, really, really important right now that if you don't feel well, you stay home until you recover, get tested, or at least are fever free for 24 hours. Washing your hands, covering your cough. It's really, really important that we use those prevention measures right now.
Talking with Pepin County Health Officer Heidi Stewart today. Heidi, we have flu vaccinations going on as well. Do we know, was this vaccine for this year going to be more geared towards that H3 strain, or what have you been told about that?
So that strain is in this vaccine, but it's important for us to remember that when there is breakthrough infections, and breakthrough infections are when somebody's been vaccinated and they still get ill. That H3 strain is one that has a tendency to cause those breakthrough infections. So even though the vaccine is set up right, it is possible that individuals still could get ill with it. Most likely a lesser case, but there is still that possibility.
Talking with Pepin County Health Officer Heidi Stewart this afternoon. Meanwhile, with all this going on, are you still able to do some of the other things that the health department likes to do? You know, you have clinics, you have other, educational opportunities and things like that for the county, or are you kind of just stuck in this rut here of COVID/flu? You're always kind of trying to stay one step ahead of that train, and the train keeps getting closer.
Yeah, so it's interesting that you asked that. You would have thought we would have had a conversation ahead of time about this, but we haven't. I've really spent some time trying to organize and get ready for 2022 in hopes that we can maybe get out of this rut, whatever I think rut is what you called it, out from underneath all the requirements and the follow-up that COVID entails. So back to some of the programming, like our regular immunization, our maternal child health outreach, our mental health, our AODA work, all of that prevention work that we were doing before has been on the back burner. And we really want, all of us in the department really want to pull that out and start working on that. Our reproductive and health family planning program has been functioning throughout COVID. But our numbers are down, so we need to look at getting that program back up and making sure everybody knows that that's offered here. So I'll use this as a way to plug. We do have 2 open positions here at the health department. One is an administrative specialist position, which is really a support staff work for the public health specialist and the public health nurses. That is a part-time position. And then we're going to be taking it to the Board of Health this Thursday to go ahead and hire our limited term employee public health specialist. So that would be a full-time position as long as we have the extra COVID funding to help with some of the COVID work so that we can return to some of the other normal programming. So great question. There's been a lot of discussion and a lot of effort to try to pull out some of that documents from what we did prior to 2020.
All right. Well, Heidi, again, we appreciate you joining us today.
Thanks, Brian.
That is Pepin County Health Officer Heidi Stewart.